Welcome to Seniors on the Move. You are in for a treat. All your questions about drugs, or almost all, right, will be answered. It's very important, and I'm so glad you're with us today. And we have Dr. Donna Bartlett. This is her book. And what do you call this, a workbook?
A workbook.
It's a workbook. It goes along with the book. It's wonderful. Let me read some very important things. Dr. Donna Bartlett is a board-certified geriatric pharmacist. She specializes. Licensed in Massachusetts. Currently, she is professor of pharmacy practice. Her education, expertise, and areas of interest include polypharmacy, which she will explain to you. Deprescribing. Is that a new word? Or is it been
It's
around?
about 20 years old.
About 20 years old, because that's the truth.
Considered
That's what we're
new.
going to... Also geriatrics and falls prevention, which I'm very into. I'm in a study with that actually right now. She's author of MedStrong. This is a long title now, get ready. Shed Your Meds, love it, for a better, healthier you, aging well through deprescribing. And she will explain it, so don't do anything until you listen to her. And she also has the MedStrong workbook, which is going to be a big help too. All right, she is also host of the Med List, is it the Med List podcast, and speaks locally, nationally, and internationally on the importance of reviewing our prescriptions and non-prescription medications, and also taking what is necessary, only what is necessary. The key word is only there. All right, what are we going to talk about first, Donna? A few statistics about
Sure.
drugs and seniors.
Yeah. So we are over-medicated, unfortunately.
Yes.
But it's not just here in the United States. It is worldwide that we have an over-medicated population.
Wow.
So there are people who deprescribe all over the world. Where I've spoken internationally, it is the International Conference on Deprescribing that they've already had a couple of conferences, and the third one is going to be up in Montreal in the spring of 2026. But really what we are thinking about is the statistics, right? And how many meds are people taking? So many people that are 65 years and older, they take there's probably about 68, 70% of people take one or more medications.
Wow.
40% take 5 or more medications. And the reason why that's important is when we talked about polypharmacy and what does this mean, the whole deprescribing word became popular in medical literature in about 20 years ago, in 2003, so 22 years ago. And so it's still in its infancy. We're starting to get out of the infancy stage and it's becoming more popular, but there are a lot of people who take 5 or more medications, and everything counts. It's not just prescriptions, it's prescriptions and non-prescriptions.
OTCs.
It's OTCs, supplements, herbals, no matter what you're taking, because people love to say, oh, I don't take any medicines, but I take a lot of supplements. And I always say, everything counts. It doesn't matter what it is. If you're physically taking something every day, then it counts as to one of those.
All right. The definition of polypharmacy, just in case. I mean, it sounds like the word, but
yeah.
Go right
So
ahead.
there really is no particular number for polypharmacy. According to our medical literature, it tends to be 5 or more because that's what they have put a number on as we go through medical literature. Some studies look at 4 medicines. The majority of them look at 5 medicines. When we get to 10 medications, it's called hyperpolypharmacy.
Okay.
So, and again, it means not only prescriptions, but non-prescriptions. So again, everything counts for that. And and as we increase the number of medications we take, we increase the risk of an adverse drug event. So think about that. If you take something, you may or may not have an adverse event or something, but if you take more and then more and then more and then more, there's more chance for interaction, there's more chance for side effects, there's more chance for similar side effects to be additive, causing a more likely form of a particular side effect.
Wow. What is the most medications that you've ever seen someone take or heard about? Or
So I have I have a practice site at a hospital too, so I do see people who have fallen and come into the hospital, and they're on many, many medications. But I've seen well into the 20 or 24 count. I've also seen people take supplements or herbals that are combined. So they'll take like 3 different herbals, but they're combined herbals, and counting all of the different herbals that are in these 3 things that someone has taken was 33 herbals that they were taking plus the medications they were taking. So it was just 33 herbals within 3 capsules that they were taking. So it's not just, I'm taking one thing. How many things are in that one thing too, depending upon what it is that
When
you're
you
choosing
find
to
someone
take.
like that, what is the first or second step? I mean, do you talk to the doctor, or does the doctor send you to the hospital to check on these people? I'm just a little curious.
Yeah, it's more or less us finding the patients. In that particular case, a family member had asked us to look at the medications that this person was taking, and could it have been part of the issue as to why they were in the hospital? And it was, most likely. But what we see, because my site is more transitions of care, so when people are home and then something happens to them, they don't feel well, they have an exacerbation for, COPD breathing issues or heart failure, and they have a lot of edema and they having a hard time, breathing, or they don't feel right. Those are the types of people that we tend to look at, people who have fallen at home and then come into the hospital. So we look at their meds and say, hey, what changed? Or what was going on at home? Or, were they taking their meds? Did they not see the signs of an exacerbation? Or were they confused or lightheaded? Or did their blood pressure drop because they took their meds incorrectly maybe? Our bodies change, so it can be just that their body has changed.
Do you work with diabetics at all? Type 1 and type 2?
Absolutely.
Wow.
So,
tell us a little bit about that, your role in that.
Yeah, so with that, some of it is training, so making certain that people are taking. So for example, let's start off with insulin for type 1, for people with type 1 diabetes. And how are they taking their medication? What's their timing? So how long before they eat, for example? When are they taking their long-acting? If they're on a pump, how are they using their pump, for example? For oral medications for type 2 diabetes type of patients, trying to figure out timing again. And there tends to be multiple meds that people take in order to treat diabetes. So understanding whether or not they're taking things properly, proper foods, what about carbohydrates and proteins and fats within their diet? Have they begun a healthy lifestyle? Are they walking more? Have they lost some weight? What's their blood work, their A1C like, and can we make adjustments so that they don't go too low? Because we don't want people to have a lot of lows either. Because lows, especially in older people, can have significant effects. It makes your heart rate go fast and other such things.
Which branch? It says who is over medicated. What do you mean by that exactly?
Yeah, so a lot of people don't think they're over medicated, and they think, oh, that's not me.
Really?
Oh, I've been taking this forever. Oh, my doctor put this. My doctor gave me these, so therefore I must need them. I know this is good for me. I saw something, or someone told me I should take this, and I know it's going to be really good for me. In regards to, maybe an herbal or an over-the-counter supplement or something. But what people don't realize is that they could be causing a drug-drug interaction that they don't even realize they're doing. So I'll give you a very simple example is often people will take medicine for cholesterol. And they'll take...
Very common.
Yeah, and they'll take a statin, the family of medication. And they're LDL, that bad cholesterol, just isn't quite going down. But they're also taking omega-3s. They're taking a capsule of omega-3s. And omega-3s, one of the side effects, if you will, is that it can cause your LDL to increase, your bad cholesterol
Who
to
knows
increase.
these things, you know?
Or it might not get it to come down like the statin wants it to, right?
Yeah.
Or you want it to.
Yeah.
So people think they're doing a great job by, I'm taking my statin and I'm taking my omega-3 or my fish oil. And what they don't realize is that they might not be getting to the target that they're hoping for their LDL because of the fish oil that they're taking. So sometimes it's as simple as stop the fish oil, take your statin, and let's see how that goes. And then their LDL will
How
tend
often
to
should
reduce.
people check on that? I mean, some people are taking blood pressure medication for 30 years.
Yes, yes.
I bet that's one of your first questions when you talk to them.
And they say, how should I start, continuing to take this? So some of the things that you want to be thinking about is when you stand up, do you get lightheaded and dizzy? Do you have trouble walking now? Do you feel unsteady? Those are some things that people might not realize. People love to blame things on age.
Yes.
Like, when I get up, I get so dizzy, I must be getting
Good
old.
point.
But it's their medicine that is probably causing a drop in blood pressure.
Wow.
And what I find that people don't necessarily consider is that their body has changed over the years, good, bad, or indifferent. You might be working out more and healthier than you were 10 or 20 years ago.
Yeah.
Or you might not be. Maybe you're sitting on the couch more. But no matter what, your body changes. And how we metabolize our medications, how our liver is functioning, and how we eliminate medicines, for example, how our kidneys are functioning, can change because those are changing. So even though medicines might not have been a problem 20 years ago, they were the right thing for you at that time and you needed them. Maybe 20 years later, now, they might be causing more harm than benefit.
We need more people that do what you do. How is that going? Is there an interest from people like you?
Yes.
How do you get the word out? How do you talk someone into maybe choosing that for a life's work? Seems like you have to know an awful lot.
Well, it is part of pharmacy. Pharmacy is really good about learning and educating and counseling patients for that. I do have a geriatric concentration for pharmacy students, so they are able to learn this, and we deprescribe together, and that's what I do at my site is with my students is we're looking at patients' medications and making recommendations.
Sounds like a puzzle. It's a puzzle.
It is, and I love it. I feel like I'm sleuthing.
This is exciting. Now this one, how willing are people to change a medication?
Yeah,
because
so
we worry. I think older people just tend to worry. They've seen more. They know what can happen.
Yeah.
So talk to me about that a little. How do you?
It's not easy. Some people are very willing, but some people, there's many people who are not because they think, I'm supposed to take this for the rest of my life because that's what they were told is. I'm supposed to take this for the rest of my life. I'm still here. What am I doing? And or why are you trying to take something away from me? And when we start looking at, you've probably lived longer than what was originally expected 20, 30 years ago when you started on this medication. But also, again, your body has changed, or maybe you've made some changes that you might not need the medication anymore. The other thing I like to tell folks is, if you stop a medication and you need it, doesn't mean you can't go back on it. So we'll figure it out. Just like when you take a medicine, how do you know you're going to have a side effect or not? You don't.
You don't.
You don't until you try it, right? So how do you know if you're going to really need this medicine, if you're going to have a withdrawal, or if there's going to be, you're not going to feel quite right? We're not going to know. We can pretty much understand what's probably going on, but until you actually try to reduce it slowly, then we'll really know, right? So it's really important that we stay in connection and that we monitor and document and follow up. So say, for example, somebody is going to reduce their blood pressure medication. They just might need to check their blood pressure at home while they're doing it, and then connect back with the doctor in a week or two. How's it going?
You don't change it yourself. You have to talk to your PCP.
Exactly.
Do you work with the PCP? Do you have to I would think. Let them know.
Yeah.
And you,
So that can vary. When I speak with people and do medication reviews, many feel empowered. They feel better about having a better conversation with their
Sure.
providers. Some family members might be in the conversation with me, with their loved one that we're trying to help. So they feel better and more confident about speaking with the provider. Some families have sent information, because I write things up, and they'll send the information to the doctor ahead of time and say, we really want to talk to you about this. Could we have a discussion about the medicines? So I think if you're open and honest about it, you're not going to, no one starts on 20 medicines. No one. You start on one, maybe two. Maybe if you've had a heart attack, there's 5 that you're going to go on. But you're not going to start off with 20 medicines. You've accumulated that as a process. You don't go to the pharmacy one day and all of a sudden have 20 things that you're taking. So it's a process. So it's the same thing with deprescribing. It's a process. We got to do it one thing at a time. See how you're doing. Does it make sense? There are some things we can easily say, you really don't need that. And, we're concerned about X, Y, or
nice
Z.
that you don't have to take at least, even if it's just one pill.
Exactly.
It simplifies everything.
And sometimes you feel so much better, right?
Yeah.
If something's causing, for example, like constipation or dry mouth or something like that,
you don't
have
even
to take
think
it
about
anymore.
it.
It's like,
Yeah.
that's great. I think people forget how good they can feel too. And I always liken it to when women are pregnant, they're nauseous for a lot of months, and you just kind of get through it. You get through your day kind of thing. And then all of a sudden you feel better and you're like, whoa, I didn't realize how horrible I felt. And then wow, I feel really good. And I think that happens with medicines, that people don't realize that it's causing a little bit of a fatigue, or it's causing some fogginess, some cognitive fogginess or something.
So what kind of a drug might cause lightheadedness or something?
Yeah. So things like blood pressure medications definitely could, but some pain relievers might. So if someone is taking some prescription pain relievers, that could cause some lightheadedness. There's medicines that are used for sleep, medications that are used to help with urinary incontinence or urinary incontinence. So that might be an issue. So there's so many different medications, and that is one of the side effects that is pretty common with medications. So when we're looking at medicines, anything that might there's a lot of medications that aren't for blood pressure that can actually lower blood pressure too, just as a side effect.
Thought of that.
So sometimes those are making you lightheaded and dizzy because you're adding on something and it's causing a side effect. So maybe an antidepressant or an anti-anxiety.
I hope you're listening. Hope you're recording it yourself. Okay. Give us an example. What are the steps to reducing drugs?
So there are 5 steps that I go through in the book and in the workbook. And
the workbook.
Yeah, and the workbook, especially it's color-coded, et cetera. But the first thing, of course, is to have a list of your medicines. And people go, well, yeah, that sounds pretty, important. But we all have that. But I like what I want people to do is think about why you are taking it. And if you don't know, right then and there is a question mark. So often I'll see, it's a historical med. They've been on it. No one really knows why. Some prescriber years ago put them on it. No one's complaining about it, so they keep it on.
Is this common? Is it
More common than you think.
Okay.
Yes.
All right.
And so why is someone taking it? It's a historical drug.
Never heard it put that way. That's interesting.
It's a historical drug. So if you don't know why you're taking it, that's your first question.
Let me think. Oh, God.
And then, does the problem still exist? It could be that you had pain years ago and you went through PT, or you had whatever surgery to take care of whatever pain, and people are still taking pain medications because they don't want the pain, or they think that they've never stopped the pain medication, so it's still working.
And then there's the addiction thing,
Well,
too.
there's to some of the prescription ones, and I can't even say it's an addiction, but people just think that they still need pain meds, and they might not, and they could cause cognitive issues, especially some of the prescription ones. So people just continue to take it.
But think how good you must feel when there's
Yeah,
one less,
right.
two less.
Exactly.
But it's
So-
intricate. There's so
Right.
much to it.
So does the problem still exist? And then if it does, do you think the drug is really helping you? So yes, I still have high blood pressure. Is it in control? Or is it really high? And then you have conversations about that. Does this still work? Is it still what I need to be taking? Does something need to be adjusted? So that's step one, is that list. And that's where, and then you look at your list and all these holes that you have in these different areas, and you go, wow, I have a bunch of questions I need to ask.
Sure.
And so you get your questions together. So that's your second step. Your third step is you have a discussion with your provider, and you say, look, I take all these meds. I've been taking some for years. I don't know why I take this one. Do I really need all these?
Yeah.
I'm concerned. I want to be proactive. I don't want to take medicines that I don't need anymore. I don't want to take medicines that might increase my risk of falling, for example.
That's very important.
So those are the kind of questions you can frame it around, that I don't want to be taking extra. I don't want extra side effects if I don't have to have them. So then you make a plan. Step 4 is you make a plan with your provider. What am I going to do, and how am I going to reduce this, and which one am I going to start off with, so that you can start a slow process together. And then your last step is to monitor and document and follow up. So you're going to see how you feel. You're going to, if you have to, check your blood pressure at home, like I said before, or check your blood sugar, or do something like that, like keep a log. How are you doing with this change? And then you want to follow up with that as well. So, you're monitoring, you want to write it down, and then you follow up with your provider, just like you would if you started a medicine. Who just starts a medicine and then you never have a follow-up with your doctor? That doesn't work that way, typically. You start a medicine and you follow up.
You keep in touch. Okay. This is maybe off the cuff. I don't know. What about vitamins? How do you feel about vitamins?
Yeah.
Or is it just too much to know about it to even talk about it? I don't know.
Again, with everything, we're all unique. Our med lists are unique. Our comorbidities, or our disease states or health conditions we might have, are all different, and different combinations. So is it important or is it not important? And that's going to be individualized, just like whether you stay on a medicine or not. You might need a medicine, then it would do nothing for me, or wouldn't it be safe for me to take? So vitamins should be treated the same way. Really, anything we take should be treated the same way. Up here in New England, I think vitamin D is important for people. So, not everyone has low vitamin D, but a lot of people do. As we age, our muscles might become a little bit weaker, and that happens with anybody who has low vitamin D. So in order to stay strong, you might need vitamin D in order to help your muscles.
I think a lot of seniors are taking that now. I do take it myself.
Yeah.
And it doesn't need to be prescribed, or do we have to watch out for that too if we're taking
you don't want
a
to
whole bunch of other
megadose.
things?
Yeah, you don't want to megadose on these things. You just want to take what is necessary. So that's important. Do you need a multivitamin if you're eating healthy? If you have, good digestion, etc. You probably don't. You probably don't need it. Sometimes people, if they're on proton pump inhibitors, which is for stomach acid, which people are on that for way too long, and they take it for years instead of just weeks. It should only be for 8 to 12 weeks if you have stomach acid issues. So what happens after a year is your nutrients aren't absorbed as well. So you can become deficient in iron or vitamin D or B12, for example.
So many things. You have to read the book. There's so much to know. But you've written it in a way that's, of course, understandable, and you've got your 5 points.
Yes.
Do you have anything else that we really should know? What about the natural products, the herbal thing? Black cohosh, something, that's the only example I can ever think of.
Yeah.
What about that stuff? I mean, should you ask your doctor about that too, because he has not prescribed it? Or give me something common that people take that they don't ask their doctor about. The multivitamin, like you just said. To me, from what I've heard, is there's so little of each vitamin there because there's so many. There's like 3,000 vitamins in there, right? So it just doesn't make sense. But please, let's talk. We have 2 minutes, not even left.
Okay.
Get this book for yourself. Really, it's going to be well worth it. As we age, I think almost every one of us is taking something. So I'm going to try to get through all of it again because I forget a lot of things, and the workbook seems to go with it.
Yeah, it doesn't.
What does this do that the book doesn't?
So the workbook actually takes the 5 steps and it adds more to those 5 steps. It really helps people really think about their medications and do I really need this? What's a better conversation I can be having with my providers about this? So it takes those 5 points and it really asks a lot of questions around those 5 points.
All right. You have one more word to say. What would you say, or one more sentence?
So have a med review. They're really important to have. Don't think that when you're at your doctor's office and they're just going through the medicines and saying, do you take this, do you take this, that's a medication
You mean
review.
write it down?
It's not. You need to make an appointment. You need to have a full medication review.
You have to have, and I had it in. It was so great, and I learned so much. So I want to thank you for joining us today. I knew you would think it was important. It is important. And maybe you'll come back in a few years with something new. Who knows? Thanks so much. Really. Love you.
Thank you.
You
You
do
too.
beautiful work,
Thank
and
you.
we need it. Bye for now.